Happy Wellness Wednesday. Welcome back to our channel, Libra Aesthetics and Wellness. I'm Aisha Thomas, MD, the Medical Director, and
Lisa Parker, Nurse Practitioner.
Today's topic is about healthy gut, which I think is a very important topic because that's an ailment. An unhealthy gut is an ailment that many people suffer from.
Correct.
So today, first I'm going to talk about the anatomy and physiology of a healthy gut, and Lisa will segue into what an unhealthy gut is and the treatments, supplements, and vitamins that can be beneficial in that regard. So I'd like to talk about the gut. And what is the gut? It's the alimentary canal, it's the digestive system. And I think if you can think back to your biology back in class, or maybe even your dissections, hopefully not, we can talk about what the gut does. So in humans, which I'll focus on today, as you know, the gut or the alimentary canal goes from the mouth to the anus, and it has the function of digesting nutrients and making it available for the body to use. So going forward, from the mouth down, you need to have a healthy, of course, mouth, including your teeth, including your gums, having enough saliva, which helps to start the process of digestion of some sugars. And of course, it goes down your esophagus, which is the tube between your mouth and your stomach. And from there, it gets into your stomach, which has the primary role of digesting. It's a large muscular structure that takes some hours to digest food into smaller mechanical pieces. From there, it goes into the intestine, the small intestine. And that has three parts, which is the duodenum, the jejunum, and the ileum. Now, that's a very important part of the gut, because in the small intestine, that is where you have digestion of these mechanical, smaller particles of food into their sub-nutrients, into their, for example, proteins are broken down into amino acids, and you have carbohydrates broken down into sugars, and fats broken down into fatty acids. And the small intestine is essential because that is where those nutrients are absorbed through the mucosa, we call it, through little things called villi, which are sort of little pouches that have little blood vessels and capillaries in them. So they pick up those nutrients and they take it to a very special part of the circulation. So this it goes into the hepatoenteral circulation, which is where it goes into the liver. And instead of this venous blood going directly into back to the heart, it goes to the liver where it can be extracted of all the nutrients. And that is where you can have one of the issues with the gut, like fatty liver, if you have an excessive deposit of fatty deposits in the liver. The liver now also has something called like little biliary sinusoids. It makes a sort of, what it is a sort of digestive enzyme that goes down into the gallbladder, and it helps to digest fat. Bile is stored in the gallbladder, and as you hear, you can have issues with your gallbladder where you can have things like cholecystitis and gallstones. And this bile is very essential for helping digest and dissolve fatty acids. Another part of the part of the gut in this area which is important is the pancreas, because the pancreas, it secretes pancreatic enzymes. These are very essential for digesting your nutrients from your food. And of course, that is where insulin is made as well, in the pancreas. So issues with the pancreas will also affect things, could cause things like diabetes, where you can have either insulin resistance to start, or your body doesn't react well to the amount of insulin that you create in the pancreas, and it's not enough to help digest the glucose, because insulin is one of those hormones that help regulate your glucose in your body. That's really important. So I think the whole digestive system, especially in the small intestine, affects how we absorb nutrition. From here, we go down into the large intestine, and that is where a lot of the water is absorbed from the food. And in that part of the intestine, that's where the fiber is sort of concentrated. And without fiber, you can have things like diverticulitis attacks, where the gut, because you don't have any fiber against those walls, they sort of make little pouches, and these can become infected and give you issues. So through there, when the stool goes out, it gets all the water absorbed, and it becomes a lot firmer. And you should have regular bowel movements. Some people, daily if you can. If it's a whole week, we have a little issue there, right, Lise? Yeah. But that's where you have eventually the food comes out as digestive waste or stool. So in a nutshell, a healthy gut is there to help you absorb the nutrition in your food. You have many different parts of it. You have many different little organs that help with how you absorb the nutrition. And if any of those things are affected, then you might have an issue with your gut. There's one more thing I do want to mention, which I thought was important. The gut is connected to many parts of your body. You know how you have many organ systems? I'll just mention briefly how the gut is connected to other organ systems. So, for example, the cardiovascular, we talked about how it goes through the hepatoenteral circulation back to where the liver absorbs the nutrients. The endocrine system is important. We talked about the pancreas, we talked about the insulin, the digestive glands. These are all very important. Your skin is also very important because the skin talks to the gut because that is where you have the vitamin D sort of pathway and regulation. Also the lymphatic system. A lot of nutrition is also absorbed in the lymphatics of the gut. And some people might have excessive abdominal pain and issues, and they do all these tests and they can't find out, but it's really lymphatic blockage there. Another thing, of course, is your muscular system, because the gut, it has a lot of muscular cells that surround it that cause it to propel the substances down. It's called peristalsis, you know? And of course the nervous system, which is one of the most important. We'll talk about the gut-brain connection. Lisa will tell us a little more about that in a while. And of course the respiratory system, because look, the oxygen has to get into the gut and into the nutrition so that we can have that balance of absorbing. If you don't have good oxygen levels, you won't have ATP, you won't have the muscles contracting. It's so interesting how the body all works together. Right. And of course, your urinary system, the reason it comes into play is because, remember, we talked about vitamin D. The kidney is where you have the second part of hydroxylation, where the vitamin D becomes active. So, you know, the gut is really central in the body, and it's central to all of our different organ systems. So that's a little pathophysiology about the gut, and Lisa will now give you a little bit about the unhealthy gut and how we can have some solutions for you. We do have a healthy gut program here with Libra Aesthetics and Wellness.
And we try to help find out exactly what's going on with you. We do stool samples. We also can do a little bit of lab work for you. We also have some genetic testing available. So there's a couple of different pathways we can go down to help really try to find out exactly what's going on with you and how we can really help you live your best life and get the best out of your gut. That way you can be the healthiest that you can be. Some people do experience digestive issues, food insensitivity or food sensitivities, sugar and junk food cravings, fluctuating weight back and forth, some brain fog like the doctor was just speaking about. Fatigue, headaches, rashes, and even recurrent UTIs can all be linked back to leaky gut, which is issues with your digestive system. So your leaky gut syndrome is where your intestinal lining is kind of worn down. It makes it easier for harmful toxins to get in, and they break through into your bloodstream and they wreak havoc on your health. So we're going to help you with that. This is exactly what we're going to be doing. We're going to help with your immune system as well by keeping your gut healthy. 70% of your immune system comes from your gut. Like the doctor was saying, all of your nutrients are absorbed. They run into different organs in your body, and it helps just support your overall wellness. It is centralized. So you think about you keeping your core very healthy, it keeps your whole entire body healthy. So we do have a couple of natural supplements that I would like to talk to you about today. If you'd like to just supplement, start somewhere, of course, come in and see us. We have free consultation. You can come in and talk with us, and we'll discuss if there is a pathway that we'll be able to help you with. So we start with glutamine, which is an amino acid, which strengthens your intestinal wall and regulates the tight junctions. So this is basically how the nutrients are absorbed in your intestine. So we want to try to make sure that this is working appropriately. You want to try to get at least 1,500 milligrams of L-glutamine per serving, which is once or twice per day. Licorice root also helps control H. pylori that can cause ulcers and cause inflammation. And we know once you have inflammation in your gut, It wreaks havoc all over your whole entire body and can cause inflammation in all your joints and everything.
And to interject about H. pylori, it's actually one of the bacteria that is carcinogenic. So it can actually lead to gut cancer. So that's important.
That is very important to know. You're right. Fiber gum is a soluble fiber, which is beneficial with short chain fatty acids that also can help increase the health and benefits inside of your intestinal wall lining. You're taking prebiotics is essential. It's like fuel for good bacteria in your gut, and they supercharge them to work repairing and balancing your microbiome, which comes with your stool testing that we can do for you here in the office as well. So we can really find out what's going on, see what kind of supplements can really be directed for you to fix and balance the health of your gut.
And of course, to interject again, since I'm also infectious disease, talking about the microbiome is also important, because a lot of people don't know it, but it's very important to have bacteria in your gut.
Correct.
The bacteria in your gut are your best friends. You have good bacteria.
And you want to have different types of bacteria in your gut as well.
So when you say the microbiome, there's actually a study that shows what sort of bacteria we expect to see. And there's also a study that shows what are the harmful bacteria. We've all heard about C. difficile or C. diff, because that went around causing havoc, killing people.
Right.
This causes extreme diarrhea. It's a very toxic situation to have. And of course, we know the basic things like lactose insufficiency and other things that people suffer from. But the microbiome is essential, because in one of our tests, when we do the stool test, we look and see all the gut flora you have, so we can see if it's normal or abnormal. And we don't want to kill the good cells. We want to replace them with good probiotics too.
Right.
Because as we know, the probiotics are good bacteria that can help, especially if you're taking antibiotics. We usually send our patients a link to get a very good supplement for that.
Through our company, Full Script. So we have a whole slew of supplements that can help you. So we will get you introduced into the catalog, and that way you can look through them and see what can work best with you, along with whatever our suggestions will be as far as your personalized plan moving forward. We do have an IV cocktail as well that can help with your gut becoming a little bit more healthy. It is called the Liquid Lift. You can come into the office and get it. It's packed with vitamin D, which promotes your gut barrier integrity. We've got glutathione, which we all know is the master antioxidant. It contracts oxidative stress in your gut, kind of helps heal what you've got going on in there. Your choline, which is also inside of the IV nutrition, and it helps build the cell membranes, and it acts kind of as a surfactant in your GI tract. So, you know, if you're inflamed and it's kind of irritated, it can help kind of calm and soothe that down and try to help with the passing of what you've got going on in there. Can I say it like that? Your vitamin C also helps reduce inflammation. We all know inflamed gut uses vitamin C quicker, so it's just to help supplement. And these IV infusions go directly into your bloodstream, so it bypasses, so you get a better amount absorbed into your body, and that way, you know, you have a higher amount in your body, you can heal yourself a little quicker that way.
And therefore, that's why I interject again, because a lot of times people do take supplements and they find, why are the supplements working? They'll tell us, you know, I've been taking vitamin D for years, and we check their level and it's low. It's not a goal. And it's really because the gut is not working well. It's not absorbing at the level of the mucosa. And so you're not getting into that enterohepatic circulation to be able to take the nutrition into your bloodstream. Because anything you ingest by mouth, you need to break it down. You need to pass it through the liver. So if you have an unhealthy liver, unhealthy gut, it's very difficult to get the IV nutrition, to get the nutrition you need into your cells. So that's why I do believe intravenous nutrition is important, because there are a lot of people, you put you through a healthy gut program. We need to reset your gut. We need to heal the gut. But if we just stuff you full of vitamins by mouth and your gut isn't healthy. So many times in many of our programs, you know, we have about 8 programs here. Actually more like 10 programs now.
I know.
But in our programs, we give an intravenous nutrition, usually by the 1st or 2nd visit, because we want to be able to get your cells healthy enough, jumpstart you, like you said, so that you can absorb the nutrition that you need eventually orally.
Correct. So exactly right. So we have the IV, then we also transition over to IM, which is intramuscular injection, which we also supplement with the vitamin D, the glutathione. We have the B12, the B complexes. That helps heal your gut as well. So we try to get you as healthy as we possibly can before we turn you over and release you onto oral supplements. So B12 helps improve your improve digestion, and I'm reading my handwriting here. It's terrible, isn't it? Pyroxidine is deficiency is strongly linked with a higher rise. Oh, this is what you were talking about, the carcinogenic factor. So this helps elevate your B levels and to help lessen your chance of colon cancer.
Yeah, because many of them, we can do B complex because vitamin Bs are all very essential for mucosa, for hair, for skin, for nails. And remember, there's epithelial lining in a lot of the intestine, a lot of the gut, including the esophagus, including the anus, the rectum. So these areas can benefit from B vitamins. So that's something we'll also suggest, because pyridoxine is known to be something that's against cancer itself. So many people don't really know of the deficiencies they have. And a lot of people try to treat, especially in traditional medicine, because of course that's how I trained, allopathic. But you know, with patients asking all the time, how can I get better? I say boost your immune system. They say how exactly to do that. I realized I had to go down a path of really learning a little bit more in integrative medicine. And therefore, that's why we're here in the wellness program. So we'd love to see you here in our clinic. It's our pleasure to help you feel better. And we see people all the time reaching their goals, whether it's weight loss, whether it's clearer skin, whether it's being able to have a healthier gut that they can digest and not feel so ill. It makes us, that's what really makes us smile here. So we'll be happy to see you walk in. Absolutely. You can go to our website, Libra Aesthetics and Wellness.com. You can reach out to us on the telephone, 772-388-9155. As Lisa said, we do some wellness consultations for free initially. You can also reach us to do a virtual consult, because you know how it is here in the pandemic. But I feel like this is beneficial, especially IV nutrition, for many people in our community. So thank you for watching our video today.
Thank you.
We'll be back again for Wellness Wednesday next week. Please like, comment, subscribe, hit the notification bell, and we'll see you again in our next video.
We sure will.
Bye.
Thank you.